So here's a question that I've been bombarded with since posting a video on my MBCOT journey, and it is this. What strategies did you use to pass the board exam? Now, this is a loaded question and one that's very difficult for me to answer because we're different. All of us are different and we have different learning styles, and what might work for me may not work for you. And having said that, I think there are important strategies that I employed that I believe helped me pass the exam, and it is the ability to understand and read and deconstruct the question. And so today I want to just point out some strategies that I used and some key things that I think are important to consider when you are going through your practice exam questions, as well as the questions on your actual MBCOT exam. There are three things that I'm going to talk about. One, the occupational therapy process. Two, the practice setting. And three, the frames of reference. Now, I already have a video on the OT process, so I'm not going to go into that too much. And I won't be going over all the practice settings and the frames of reference, but we'll be giving you examples in each of these categories just to give you an idea of what you should be looking for. For OT process, why is this important? So in my video, I talk about how if you have just completed an initial screening, it would be premature for you to go on to selecting and choosing long-term goals because you haven't done an evaluation yet. So in every question, you must first question, where am I in the occupational therapy process? Where am I in the delivery of care? And is this answer choice appropriate for this time, or is it premature? Is it safe at this time, or is it not? So understanding the OT process and applying that to every question instead of trying to memorize the steps. Screening is this, referral is that, outcome is this. Understanding the flow of the service delivery model is important when you are approaching every question. Second factor to consider, the practice setting. Now, this is important because depending on what practice setting you're in, the kind of intervention strategies you employ might be different. So let me give you an example. Let's say that you're reading a question about a patient in an inpatient acute setting, acute inpatient. Now, the length of stay is short in this practice context, and so will you be choosing goals that are long-term goals and are focused on community reintegration? Probably not. Your assessment will likely be quick, and your intervention will most likely focus on stabilization of the patient so that they can first become medically stable. Versus if you were in a rehab setting, you would understand that the patient coming into this setting is already medically stable and the length of stay is far longer than the acute inpatient. And so your assessment may be more thorough than when you were an inpatient and extensive, and the intervention would focus on performance areas, occupational performance, and developing compensatory strategies, developing skills so that they can go back to their occupation. So depending on what practice setting you're in, your choice of assessment and intervention will be different. And this is why it's important for us to know the practice setting and to apply them in every question. Third, frames of reference. We must understand why it's important to know this. And the reason for that is because the frame of reference, these theories, should help us in guiding the appropriate selection of intervention strategies. So in addition to knowing the practice setting, you must understand the difference between, for example, a biomechanical and rehabilitation approach. The main assumption for a biomechanical approach is remediation is possible. And so instead of focusing on compensatory strategies, adaptive equipment, or environmental modification, biomechanical approach will have things like increasing range of motion, strength, endurance. There will be splinting here. Versus a rehabilitation approach is the opposite. So instead of focusing on the specific deficit, the key principle and assumption here is your understanding and acknowledgement that a loss function may not be regained. And so we will be focused on compensatory approaches, adaptive equipment, environmental modification. And instead of focusing on what they need to correct or restore, that may not even be a requirement or the focus. We are focused on the client's remaining abilities and trying to get them to a functional level of independence so that they can continue to engage meaningfully in an occupation of their choice. So understanding the frame of reference isn't about you trying to learn what each framework is, its history and the definition. It's to help you guide the interventions. So think about what practice context would fall under each frames of reference, what sort of assessments and intervention strategies would be appropriate under each frame of reference. Okay? All right. Beyond those three things, and obviously I didn't mention the diagnosis or the condition of the patients because that inevitably is one of the first things all of us look at. So I didn't mention that because I felt like that was an obvious one. But when you are considering the diagnosis and the condition, here are some things that I think is important to consider. Safety precautions. So make sure that you know the sternal precautions, the hip precaution, what is the MET level that is appropriate and safe after cardiac care operation. So we are always thinking about safety precautions, contraindications. Make sure you also focus on key words like recently diagnosed with, or is it chronic, is it degenerative, progressive? And after you've considered everything that I just mentioned, here are just a few more things. Is it occupation-based? Is it client-based? Is it helping to enhance their performance and engagement in meaningful activities? Is it safe and is it ethical? All right, so we got through all of that. And finally, if you're taking your exam this week, and I know some of you are, be sure to take some time to relax and most importantly, stay confident. I think your level of confidence has a lot to do with how you perform on the exam. So don't psych yourself out the last minute thinking you're unprepared, that you're not smart enough. And I get these messages from you guys saying, oh my gosh, you know so much, you're so smart. I am no different than you. I simply took the exam before you did. And before long, once you've taken the exam and you've passed, you're going to think, oh my gosh, I'm just as smart, if not smarter than her. So you've got this. You can do it. When you're down to 2 answer choices and you don't know what to select, but you've already selected an answer, don't go back and change all your answer choices unless you're absolutely certain that it's the correct one. Because I really believe, and not just for the MBCOT exam, but in life in general, your choice that comes from your gut intuition is often the right choice. So don't waste your time going back and changing your answers. Stay confident and calm. Even when you don't know the answer to a question, know that you don't have to get 100%. You're not going to know the answer to every question, but you have to stay calm and approach the next question with equal level of confidence that you can do this. Okay? Whew. All right, that's it for today. I will talk to you guys next time. Bye.